Wendell, you're a former member of the insurance industry. What's your take on all of this?
Well, absolutely. In fact, until a few years ago, Patrick and I would have been brethren. We would have certainly been on the same side. In fact, I wrote a number of speeches for my CEO and delivered some myself, that the government should get out of the way and let the free market work its magic in healthcare. I came to realize the free market doesn't work in healthcare like it does in other sectors of the economy. In fact, it often works just the opposite. And that's one of the reasons why we saw so many people who were uninsured and now a growing number of people who were underinsured. One of the things that I wrote, for example, was a white paper to try to diminish the importance of the problem of people without insurance. And I was trying to make people believe that those folks were uninsured by choice. But I was obscuring a very important reality. And that was before the Affordable Care Act, when there was more of a free market. Insurance companies refused to sell coverage to people because of pre-existing conditions. They were turning down 1/3 of applicants because of pre-existing conditions. They were charging women more than men. They were charging older people far, far more than younger people for the exact same policy, which is why so many older people were uninsured.
Do you want to comment on that, Patrick?
Yeah, I don't know that we would have been on the same side. I think that when you start talking about insurance and pharmaceuticals and a wide variety of other interests in the healthcare space, they have been kind of in bed with government for a long, long time. And in fact, when you're talking about the insurance side of it, one of the attractive parts about the Affordable Care Act was that they were going to be guaranteed customers. And so the problem isn't so much that the market wasn't working before or isn't working, is that it was never really allowed to work. And to the extent that we have government stepping in and saying, we're going to make more decisions for you as, the public, I think that's just a bad option. I think that what you really want to do is make sure that people can actually shop around a little bit more. And unfortunately, we've taken health insurance to mean something very different compared to other forms of insurance. When you get your car insured, usually it doesn't include oil changes. When you get your house insured, usually it doesn't also include cutting your lawn or other items that are oftentimes used, done out of pocket. I think that when we talk about health insurance, a lot of times what we're really talking about is a full-blown maintenance plan. And until we start talking about insurance for those catastrophic events that are going to happen to us, or there's a percentage of the public that it's going to happen to, we need to make sure that we're talking about insurance and not talking about maintenance plans. And I think once we start talking about that, I think we'll be talking about costs, getting those down, and making insurance and making care more affordable and accessible to more people.
Ed Weisbart, I think I saw you roll your eyes a moment ago.
Yeah. So my problem is that what you're describing is, frankly, the most expensive way we could do this, and I'm just far more prudent than that. So, for example, if you have somebody whose kidneys stop working, we as a country have decided that when they need dialysis, we're going to make sure that they don't have a financial barrier to getting dialysis, and so they get onto Medicare. And that costs roughly $80,000 a year. So the country has decided we're not going to let you die. We're going to make sure that you're insured. You have Medicare for that. Well, that's roughly $80,000 a year, and I think it's just far more prudent to make sure that they have the insulin that they need. I see patients constantly who take their insulin every other day instead of twice or 3 times a day as they should. I see people constantly who can't afford their blood pressure pills, and it would be so much less expensive to prevent the kidney failure than it would be. So unless we're willing to walk away, that's not a good strategy.
But Wendell, could we afford as a government to put everybody into this position where the government's paying all the bills?
No, we can't afford not to have a system like that. We are spending $3.5 trillion as it is on health care, and at least a third of that is not going to pay for care. It is eaten up by administrative costs, and a big chunk of it goes to enrich shareholders. And just back to what we were saying a bit earlier, what Patrick is describing would work great if we were a country of very wealthy people and could afford out of their own pockets to pay for care that's not catastrophic. But the median savings account in this country is just $4,000. And most people are in insurance plans, if they have coverage, that has deductibles far higher than that. We're the only developed country in the world in which people are filing for bankruptcy because of medical debt, and many of them, in fact, I think probably most of them, are insured. And the problem of competition in health insurance, and I was absolutely a huge advocate of that, but when you have multiple insurance companies, you have to have high administrative costs within those companies themselves, but also it requires a lot of people who work for hospitals and doctors who do nothing more day in and day out, but try to make sure that they're paid appropriately and that their patients are getting the care that they need. It actually, that's why I said it works the exact opposite competition and the free market in healthcare, because the more insurance companies you have supposedly competing with each other, none of them has a very big market share. So they are at a disadvantage when it comes to negotiating prices with doctors and hospitals. And in fact, that's why we have seen so much of a continued rise in medical prices as well as premiums and out-of-pocket expenses.
Patrick, is it an issue that we can't afford not to do it?
I think that we can't afford to do it, frankly, and particularly when you start talking about just the state's finances. If we look at fiscal year 2010 versus fiscal year 2019, just look at the Medicaid portion of the state's operating budget. In 2010, the state spent about 18% of its budget on Medicaid. In fiscal year 2019, it spends 37% of its operating budget on Medicaid. And so when we talk about government spending, first of all, we have to remind ourselves that we are the government. But second of all, when we look at the programs themselves, before we even get to whether or not they're effective, which in the case of Medicaid, it has a long history, a long track record of research that shows that it is not a good program for the poor. So if you're trying to help the poor, Medicaid is a really bad option and has been ineffective for decades. But if we're just looking at the cost of it, the cost of Medicaid continues to explode because fundamentally the cost of healthcare in this country is not being dictated by the market. It's being dictated by government impacts, government influences, government mandates that require that insurance, in the case of Obamacare, be purchased by people, and that insurance required certain coverage. That is why you're seeing costs go up, is because people aren't getting a good idea of exactly what they're getting for their money. And until you get a clear marketplace for this health care, you're always going to have cost problems. But the idea that centralizing it in government is going to somehow fix the problem, we have government health care already, and it doesn't work in terms of reducing those costs.
Well, clearly there are many arguments on both sides of this issue. We're going to have to take a break, however, in our discussion of it for just a moment. We'll be back and continue on the subject of universal health care in just a moment. This is St. Louis on the Air on St. Louis Public Radio 90.7 KWMU.